So, cardiovascular pharmacology, in which we have hypertension treatment. The primary essential hypertension treatment is uh, thiazide diuretic ACE inhibitors, ARBs, CCBs, and they are called first line drugs for HTN, hypertension. And these four are the classic first line drugs. Again, what are they? Uh, first being thiazide, second being ACE, third is ARB, fourth is CCB. Okay. Uh, so if this is the first line drug, now what is the second line drug? So second line drug would be either you increase second line treatment for hypertension is going to be either you increase the dosage of these drugs, that's one thing, or some other hypertensive drugs, and we will talk about those just now. So now here we have, if we have hypertension with heart failure, we are going to use not all of four but three of the top. And if you look, we use diuretic ACE, ARBs, right? These are the three from top. But now the extra things are going to be for heart failure specifically. We are going to give beta blocker in compensated heart failure. And why is that? Because beta blocker must be used in caution with decompensated heart failure and are contraindicated in a cardiogenic shock. So beta blocker only in compensated heart failure, and aldosterone and antagonists. What are the aldosterone antagonists? They are the spironolactone. And what does it mean when we say compensated heart failure? That means when ejection fraction is normal. So you have a patient with a heart failure, but ejection fraction is normal. So there's a compensation going on over there. Okay, one more high yield point about this heart failure is your CCBs are also contraindicated because they cause edema. That's why. In heart failure, you're already looking for, there is going to be edema, right? And if you give CCBs with heart failure, it's just potentiating that problem. Peripheral edema will be seen, and a lot of peripheral edema. So in heart failure, ARBs may be combined with neprilysin inhibitors like sacubitril. High yield point that in heart failure you want to add ARBs plus sacubitril, and we'll talk about that drug later on. And if you have someone who has hypertension but with diabetes, what we can give to that patient is, again, just from the top four all here, ACE, ARB, CCBs, thiazide. One thing extra is the beta blocker. Okay, hypertension and asthma. So you just want to give ARBs, so three from the top. So what are those three? ARBs, CCBs, thiazide diuretics. These three from top. What is extra? Cardioselective beta blocker for asthma. Avoid non-selective beta blockers to prevent beta 2 receptor induced bronchoconstriction. Avoid ACE inhibitors to prevent confusion between drug or asthma related cough. So as you know, that ACE inhibitors, they cause dry cough, right? And we will talk about that here. And that's why we don't want to give ACE inhibitors, because we don't want to confuse that cough with asthma. Is it due to asthma or is it due to drug? Right? And for the non-selective beta blocker, because we don't want a bronchoconstriction by giving non-selective beta blocker, we have to give cardioselective, meaning which is just going to go and work on the heart and not on the lungs in which you are having asthma. Okay. The last one is about pregnancy. This is high yield. Now, the mnemonic for this is new moms love hugs, right? Nifedipine, methyl-dopa, labetalol, hydralazine. New moms love hugs. And And that is going to be it for this section. Again, just going back, review this thing. You got to know the first line drugs. First line drugs are these. All four are first line, which are thiazide, ACE, ARBs, CCBs. And then here in heart failure, CCBs are contraindicated. Beta blocker would be contraindicated if it is not compensated. Aldosterone, you're adding extra, which is spironolactone. With diabetes, you're adding beta blocker. With asthma, you're being selective in the beta blocker. And with pregnancy, the whole thing is very high yield. New moms love hugs, nifedipine, methyl-dopa, labetalol, hydralazine, and that is all for hypertensive treatment. So now let's look at how and where are they actually working on.